So we talking about testicular cancers or tumor. That's important that we talk about it because it's one of the few cancers that the treatment can be very, very effective. If you treat it well, about 98% of people are alive in 5 years. Of course, if you also don't treat it well or find it early, then that can be very, very difficult for us, leading to death. So you can compare 5 years of almost living to virtually dying because you presented late or you're not come early enough for us to see. So we are happy to talk about testicular cancer just because opportunity to prevent it causing death and injury to people. Now, it's a very common cancer in some parts of the world. We talk about the Scandinavian or the European areas. It's not very common among us, but it's still worth thinking about it. When you say cancer, it means that the potential to cause death is there. We are seeing that it's not easy or you don't get it too often among our group. And then it's one cancer that you can be able to detect it early because it grows or develops in the testes, and the testes are available for us to examine. So normally we say that if you're a young person, it's good that you continue to check on the testes to see whether there is something growing in it. So unlike this cancer that we find in elderly people above 60, 70 years, testicular cancer tends to occur in younger people. It tends to occur in very, very young people. Now, we say young people, we're talking about 25, 30, 35. And so it's important that you're able to identify it early for this group of people who will live their whole. With all cancer, we say that we don't know the cause of it. But you know there are a few things that can predispose the testes to develop a cancer. The commonest is when the testis does not develop and come into the scrotum. When the testis forms in the abdomen, and as one grows, pregnancy progresses, it comes to form and lie within the scrotum. When it's there to see, but if it is in the abdomen or along the course of its transport, they can develop cancer from what we call cryptorchidism. Another cause of this cancer is related to radiation exposure and other chemicals that people get exposed to. Sometimes we use radiation to treat cancers of the rectum, cancers of the colon, cancers of the prostate. Once we expose the testis to this radiation, then we can also develop cancer from it as well. Sometimes it runs in families. We also know that if you develop inflammations of the testes, especially when that means your testes getting smaller, what we call atrophic testes, that also predisposes you to develop cancer. So we always say that if your testes is small, you must watch it. Every time you see that your testes is getting bigger and bigger, then you should get worried because maybe there's something that is growing in it. How do people present? Normally, we see it as a swelling of the testes. Once it becomes a bit heavy, you can see that one testis looks heavier than the other. Pretty soon it becomes a big swelling and a large swelling. Normally, there is not too much pain, but as it gets larger and larger, you get pain. If it becomes a bit too heavy, sometimes it twists on itself because severe pain and swelling, what we call testicular torsion, arising out of it. So these are the local things that you find. You don't do much about it, then you get an ulcer or a wound developing on it, and then of course it also spreads to other places. So you can have a testicular cancer and you are losing weight. You are coughing, you are jumping because it has spread to other places as well. How do you treat it? Normally, you want to get what we call a biopsy to confirm that there's a testicular cancer. But unlike other biopsies that we take a minute through and pick one, we don't do that for testes, no. You want to get a little cut in the groin, bring the testes out of the groin hole, inspect it. If you suspect it's a cancer, then remove it all and pick it for the pathology. That surgery can be cured if it is a localized disease. When it is not localized, then in addition to this surgery, maybe with a few chemicals to give or even radiation to be able to control the tumor. As I said, if we treat it, the 5 years survival is over 98%. It's a very good cancer that when we find it early, we can treat effectively. So when we're talking about testicular cancer, they're saying there's a cancer among the younger people. If you get it, you treat it completely, you get almost a cure. But 5 years time, about 90% are alive. Compared to other cancers, that is, well, just only half of them are alive. There's almost everybody is alive. And the test is hanging there. You can even detect it by examining yourself. It also comes as a swelling. Very hard swelling. Once you see that hard swelling in the testes, then you have suspicion. Once you get to the hospital, they can be able to help you deal with it.